बिहेवियर्स के ऊपर है। और इसके लिए हमारे साथ जो एक्सपर्ट हैं उनके बारे में बताना बहुत ही जरूरी है, क्योंकि एक ऐसे टॉपिक के बारे में आज हम चर्चा करने वाले हैं जिसके बारे में पेरेंट्स को, टीचर्स को, और कई बार जो इस फील्ड में प्रोफेशनल्स हैं उनको भी बहुत आबो हवा में रहते हैं कि किस तरह से हम इसका सॉल्यूशन करें। बिना समय गवाए हुए मैं स्वागत करती हूँ मिस सिमी सांथा मैम का। मैम, आपका बहुत बहुत स्वागत है। और मैम के बारे में बताना चाहूंगी, उनका कुछ इंट्रोडक्शन देना चाहूंगी। सिमी सांता is the founder and director of Precious Soul Services International. She is a doctoral student in developmental psychology, a registered behavior analyst in Ontario, and a board certified behavior analyst dedicating to sweeping social changes beyond geographies. Beside undergoing rigorous training in various ABA-related programs and courses, she completed her Master of Philosophy program in Medical and Psychiatric Social Work and Child Day Care Management program. In addition to her doctoral pursuit, she is pursuing the state-of-the-art new ABA approach known as a PFA SBT. A member of the College of Psychologists and Behavior Analysts of Ontario, Ontario Association of Behavior Analysis, and the Association of Behavior Analysis International. She is a strategic intervention committed to providing evidence-based practice and bringing significant progressive change to students and their families. She founded the Reeta Peshawaria Center for Autism and ABA service in Kerala. She has passionately delivered positive outcomes in the past 27 years as a therapist, trainer, consultant, analyst, project manager, and mentor in India, the USA, and Canada. Simi ma'am has specialized in customized program plans and services for families of diverse ethnic, linguistic, cultural, social, and economic backgrounds. She has conducted several parents and teacher training programs to empower them with the necessary skills to work with individuals with ASD. She has written several articles on autism for magazines to educate caretakers in individuals with autism. She has developed a manual for parents of individuals diagnosed with ASD called Understanding Autism. So, in इंट्रोडक्शन में भी बहुत सारी चीजें रह गई है, लेकिन ये बेसिक चीजें हैं जो मैं आप सबके सामने बताना चाहती थी मैम के बारे में। और कार्यक्रम को शुरुआत करने से पहले हमारे साथ डॉक्टर निमेश जी देसाई जुड़े हुए हैं, डॉक्टर आलोक जी जुड़े हुए हैं। मैं आप सभी का स्वागत करती हूँ और साथ ही स्वागत करती हूँ अपने सारे जितने भी पार्टिसिपेंट हैं वहाँ। आज का ये जो 2 घंटे का सेशन है, मैं उम्मीद करती हूँ कि हम सभी के लिए बहुत ही ट्रूथफुल होगा। और वंस अगेन आप सभी का बहुत बहुत स्वागत है। एंड ओवर टू
एक मिनट मैं सर से कुछ कहना चाहूंगा कि सर कुछ इफ यू वांट टू स्टार्ट।
नहीं, most welcome for our guest speaker Simmi, and that Simmi is very impressive. Want to listen to that.
Yeah.
Thanks.
Dr. Desai sir is the president of Manovikas, and he is the senior psychiatrist in our sector. Okay.
Awesome. Thank you so much, sir. Good morning, sir. Thank you, Indira ma'am. That was not needed. बहुत ज़्यादा introduce कर दिया आपने मुझे. I just want to start by saying thanks to each and every one of you who have made the time on a Saturday morning, or some people like from North America that I'm aware of, late in the night, to be a part of this. This is a topic that I'm very passionate about, and you kind of got an idea that I have been around for a long time. Been doing this for over 27 years now. And first and foremost, one thing that probably Indira ma'am missed out is the fact that I am a student, former student of an IMH, where I had the privilege and the honor to be tutored by the gems in the field. All I can say is I would like to identify myself as a former student of NIMH who is ever grateful for the tutelage that I have received. And it was one of a kind, the course that we underwent. And that is why I'm here to speak with you, because the foundations that were laid by my teachers at that time stayed with me no matter where in the world I went. I carried that within me. And that is how I had the privilege to actually be touched by an angel for me, Dr. Reeta Peshawaria Menon, in whose memory, to keep her legacy alive, to keep her work alive, that we have started the Reeta Peshawaria Center for Autism and ABA Services in Kerala 10 years back. This is a trust that is dedicated to the services of individuals with autism. And I'm really, really thankful to Manovikas team for collaborating with us, have been ever supportive to any initiative that we have taken. So Tahe Dil Se, Indira ji, Alok ji, entire team at Manovikas, without your support, this could not have happened today. Also, I want to, let's go to the next slide, sorry. Extend my heartfelt gratitude. Like I said, first and foremost is all my teachers, of course, my family members, and Dr. Reeta Peshawaria Menon, who has inspired me, who has given me the, I would say it was like a reason, or it was a cause that I identified and a purpose in my life ever since. I'm talking about 2011, December, when she first connected with all her former students and found out what we were all doing. And that is when she inspired me to continue to work for parents and families of special needs children, even in India, and not only do it in North America. And that stayed with me. I was not aware that this day would come when we would not be able to physically feel her presence. But I can tell you, since July 14th, 2012, the day of her passing, that is the day that I started this center with unconditional support from Dr. Deshkirti Menon and full endorsement from Dr. Kiran Bedi. I'm truly, truly grateful to both of them and all my teachers who have unconditionally supported us till date, all my friends, all the supporters and promoters of Reeta Peshawaria Center, and last but not the least, it is the staff members, Dr. Marine Punnan. A big thank you to you. You held the fort all these years because I don't reside in India. I'm in Canada. And in my absence, Dr. Punnan has helped hold the fort with the support of dedicated, compassionate, empathetic staff members that I just believe that Dr. Reeta made all this happen. She brought the right kind of people into our awareness who were willing and ready to support us. And that is how the small idea was propelled and has taken this level where we are able to reach out to families in a substantial way. And we are able to promote evidence-based practices. So what we practice here is applied behavior analysis. And this is again a field that is evolving. And I'm here today to share strategies that have been effective, not only that I have learned about them, but I have also put them into practice, and the evidence is there for you to see. So that's the whole point of today's presentation. Thank you all once again for being here and taking the time to understand this strategy. I want to start our presentation by emphasizing on the fact that this is a partnership. Raising a child diagnosed with autism is not just a family's or a therapist or a community's responsibility or ability to bring out that potential in an individual with autism. It is a partnership. Therapists who are knowledgeable, who have the knowledge base, come together with parents who are dedicated, who care about their children, who make the time. It is not easy. I know I'm saying all this, but it is not easy to put into practice. The community, the school, the teachers, the medical professionals, the different myriad of therapists all come together to make a comprehensive and effective plan for a child with autism. I want to share a parent's journey and a success story today to begin with, to show you how, when everything comes together, the unachievable becomes achievable for an individual, in this case, who has total hearing loss. So Sharanya, who you see in this video, is one of our therapists. I mean, she took a little break to support her daughter right now, but she has been a dedicated therapist for the past 7 years, and her daughter, who has total hearing loss, was the state first in grade 12 examinations. So if where there is a will, there is a way. And that's what this parent has made. And I want us to start by listening to Sharanya.
It's Sharanya. And
oops, sorry, I need to.
I've been working here in the speech department for 7 years now. And this is a very short journey of one of the most important phases of my life that I was in the state. My daughter, now she's completed her 12th board exams, and she was born hearing impaired. And we came to know that she had a problem by the age of 2.5. And at that time, me and my husband, we were really young, and we didn't know what to do, how to take this forward, because we never had any sort of a family history. So we were totally stuck about what to do. Then it's quite almost 18, not 18, I think, 16 years back. So at that time, we never had so many facilities also. So we spoke to the doctor, and the doctor said, we'll put on hearing aids for her, and we give her intensive therapy. And with that, she can start speaking, provided you have to put your heart and soul into it. And then you have to work really hard for this. So first, we went to the National Institute of Speech and Hearing at Trivandrum. And they said that they're not sure if this will work out, because the child is almost turning 3. So the time to acquire language is almost getting over, so we don't know how it will be. And for me, at that time, shifting to Trivandrum was really difficult, because I was pregnant also with my second child. So my husband, he also told me that we'll go for an abortion or something, probably, because we have to do something for her. So at that time, we found out there's a center in Kottayam. It was called Balavidyalaya. One of the doctors suggested this to me and said, why don't you go there and speak? And it was run by Ms. Elizabeth Sampson. Very ma'am knows her. And she had a daughter who was hearing impaired, and she also had a very successful story. So after that, she started this center, and I went over there, and she told me, initially we will start out with 1 session a week, because she's attaining 3, and we don't know. We'll see if she's able to cope up with it. We will move forward. We will take sessions every day, and then is it too long? So after that, we shifted to. She said you have to move to a space which is near to the center, and we got a house which was really what do I say? It had leaking roofs. We got a house like that because my son was I was pregnant with him, so I couldn't pick her and walk long distance. So we had to this is the house we got close by, and it was a terrible because by God's grace, we were both financially brought up in a good situation. So suddenly moving to such a place was really difficult for us. And we both, me and my husband, we both are the only children of our parents. So we never had any siblings, no other help. Luckily, my mother, she was abroad. She flew down and she was there with me. And my daughter, she never used to wear hearing aids initially because all these years, she never heard any sound. So when you eat this and you start hearing sound, it's very irritating to the ears. So she's always take it and throw it. And I have even tied our hands together for keeping this initially. And we started the therapy one day a week. But by God's grace, I worked intensively with her. And within 3 months, she started showing good results. She started saying single words. And the days of the therapy increased. And 2.5 years, I stayed there. I got my son by that time. And by the time he was 28, I gave him to my mother. And again, I continued this therapy with her. And by 2.5 years, she was almost 5.5. We attained language. She started speaking in sentences, in short paragraphs, and even her academics. We started writing in Malayalam and even facts also, numbers and all that. So they said, now you can put her into regular schooling. And we came back to my hometown into LKG, even though she was supposed to be in the upper KG. I put her into the lower KG. And from there, it was a roller coaster ride again because it was very difficult to survive among the other children because, first of all, catch up with what is happening in the class, all that was really difficult for her. Communication was very difficult. And but I used to constantly sit and work with her. And after that, it's between this, I decided that my child needed more of therapy. So I decided to go and study. I moved to London. I did my course at the National Institute of Speech and Hearing. And after that, we again came back to my hometown and her schooling continued. Until after COVID, she started telling me that, Amma, I can't hear anything properly now. Very difficult. Even I felt that when I'm calling her from the back, she's not turning. And we again went to the doctor. And the doctor told me that she's losing her hearing completely. Initially, she had 90 dB loss on the right side and left side was 80. And he said, now it's going completely. So I said, we were really shattered at that time. And more than us, it was her, because she had become big and she started getting frustrated and so many tantrums at home. I was like totally in a mess that I didn't know how to overcome this whole thing. And here also, everyone knows we all, just even I started getting upset over here. And like that, I decided that no. So even if we put her into a special school, she won't be able to adjust in the setting. School people were not so cooperative at that time because they understood, even they were finding it difficult. Then I decided, no, I want my child to study over here itself. And I made her dreams of schooling less. And I started working with her at home more. And in 10th, she got 87%. And by the time she lost her hearing completely. That is, all the auditory nerves were there, and we can't do anything about this. But then again, we decided that no, we can't leave it like this, and we put her into her level 3 left. And again, it's very hard because for me, after work, going back, sitting with her, I started getting a lot of health issues. And that's when I decided that maybe I should dedicate time to her. And that's how I left the job. And I was with her continuously during the exams. She started following YouTube channels which had subtitles, and the channels which she couldn't follow, I listened to it and I made short notes from it. And that is how she studied. And luckily, she got a 96 percentage. She's the district topper in her subject. And yeah, so now she's joining for BA LLB. And you never thought about signing. Signing was not an option at that time, because then I found out that she can speak when she can talk.
Okay, so thank you all for your patience. I really felt it was important to share a success story. As you heard at the end, this child is now enrolled for a BA LLB program. She's the district topper in her grade 12 students. So if the parents and everyone come together, thank you, Indira. If the parents and everyone come together, sky is not even the limit. Our children's potential can be realized, and they will just prove their element. They will show us what they have, provided they receive the necessary supports at the right time. So what my takeaway, I wanted you all to also reflect on this mother's journey and come up with some some things that she did that was successful, because this is a lived experience. And that is what is most important. There's a lot of information on the net. There's a lot of information everywhere. But trust me, when you practically start working with your child or your student or your client, whoever you are assigned, when you start putting these strategies into practice is when the practical problems, the issues that you may encounter present themselves, and now you don't know, you may get, like from what I heard from Sharanya, there were a lot of challenges. There were practical problems. They were considering not going for the second child. They had to make a lot of adjustments, career adjustments. She had to even quit the job to be able to support her child. They had to seek other support systems. Her mom had to fly down from wherever she was. And there were other logistical supports difficulties that we see, the problems with the type of house they rented. And what else? We also know that she had to go in, which was a plus, to learn about this field, to learn about how to support her child. So that's the really good thing that comes out of all these sacrifices, in addition to what this child was able to achieve with this parents' support. So to both the parents, to the extended family, to the community that supported her, to the therapeutic center that provided her with the services, this is such a win, such a huge win. And that's what we all need to remember, that behavior problems, this child just had hearing loss. Still, the parents went through so much. So think about individuals on the spectrum who are having severe challenging behaviors, severe problem behaviors. Those parents, they need multiple times support, and they need the right kind of direction. They need emotional support. They need spiritual support. They need physical support. They need all kinds of support. But if you are, as a professional, or even you as a parent, are not knowledgeable in why the individual is engaging in this severe problem behavior, then we have a problem. That is where the issues come. Then you may resort to supports that are not necessarily effective. So today's presentation, I would like for you to understand that we are not doing like a clinical, problem solving or a studying of every case or anything like that. I just want you to take away some strategies that are universal in nature to help mitigate challenging behaviors, to help ensure safety, televisability, and the continual trust to be built. So here we are going to look at what are severe problem behaviors. I'm going to introduce a new ABA technique that I am very passionate about. I'm getting intensive training in. And the only reason I'm saying that I'm passionate about this is because it is truly, truly effective. And I'm also going to present that case to you so that you get to see how we went about using these strategies to help this family. We are also going to cover the universal protocols like that I mentioned, and we will demonstrate that through a case presentation. And definitely, I would love to have a good chunk of time dedicated to questions that you may have. So what are severe problem behaviors? Severe problem behaviors are those behaviors that pose a risk to the individual and others, or even to the environment. So if someone is engaging in property destruction, that is causing a risk to the environment. Property destruction, destruction of your home, destruction of something in the community, all these things will come under the environment. But otherwise, if you think about it, self-injurious behaviors that cause harm to the self, the individual engaging in the behavior, or if they cause harm to others, and these may be in any form that you can think of. I really want everyone here to think of any child, any individual, anyone that you know of who engages in problem behaviors. It may or may not be severe, but if it is causing harm to themselves, if it is causing harm to others, and if it is causing harm to the environment that they are in, it is a severe problem behavior. It is often marked with the high intensity, frequent occurrence, or long duration. What does that mean? The type, the intensity of the behavior, how much impact is it causing? I have had all kinds of behaviors in my 25, 27 years of work with individuals diagnosed with autism. And I can tell you, I've also gone to the emergency multiple times with, like, my neck was once twisted to a point where I thought, like, I'm going to remain like that. I've been hit, punched, hair has been pulled. And you all know, everyone working in the field, I'm sure you have experienced these things. It is inevitable, to be very honest. If you have taken up a child, a student to support who has severe problem behaviors, you also need to be aware of the potential risks involved with it. So the intensity or the impact that it causes on someone or the environment, the frequency of the occurrence. So how many times a day is a child biting someone? How many times are they hitting someone? That frequency also makes it a high risk individual and deemed as a severe problem behavior. And also the duration. How long is this child engaging in the behavior? That makes it also a severe problem behavior. So you can think of all the examples that you have come across. I've listed a few here. Aggression of any form, physical aggression, verbal aggression, self-injurious behavior, poking the eyes, putting your stuff up the nose, putting stuff in your ears, ingestion of inedible materials that may cause harm to the body, biting self, pulling own hair, all that are self-injuries, and also injuring others. Aggression will lead to injury or harm to others. We have property destruction that we discussed, and elopement, meaning running away or wandering away. These behaviors greatly interfere with the child's development, like we all know, and also impact their social interactions. They impact their learning and academic progress. So everyone's aware of the fact that if someone's engaging in behavior, you are spending the time and energy in mitigating that behavior as opposed to teaching them something. So that's a little introduction to severe problem behaviors. At any point, if anyone has any questions, Indira, I'm more than happy to answer as we go, but we can also park them and keep it for the end, right? What is the problem? So we do know that the problem behavior is common in children with autism and intellectual disabilities. And they often are severe and difficult to manage. But we also need to understand what causes these problems. There is a problem. We do know problem behaviors are existent in this population, but we also need to get to the contributing factors. What are contributing to these behaviors? Number one deficit in individuals on the spectrum are the limited skills that they have, or skill deficits as we call them. They have issues with social communication skills. They have issues with tolerance. They have issues with cooperation. In my experience, I'm coming from my experience, the my way highway fits many of the individuals that I support. So they all want to have their way. And if you deny them from having their way, or if you place a demand to stop something, or if you delay them from having their way, somebody is waiting for a favorite, item or an edible, and you don't have it, then there is a problem. And it may start as a minor problem, but it is very easy to escalate to severe or major problem behavior. Premature demands for compliance and interventions may focus too early on gaining control without readiness. So here in this particular approach, we are not necessarily looking at compliance. I know that many individuals, many schools, many clinicians focus a lot on compliance training. We are moving a step away from that. We are introducing something before compliance training is put into practice or implemented. And we want to get cooperation from the child as opposed to compliance right away. We do want to teach compliance, don't get me wrong, but that doesn't come right away. We do need to have some patience. We do need to think through, and we need to look at the big picture as opposed to what can be achieved right away. Sometimes misuse of reinforcement or overemphasis on quickly identifying the reinforcers for short-term pairing or behavior plans also result in problem behaviors. What does that mean? Now, as a practitioner in the field, as a practitioner, as a special educator, as an educator, we all know that we depend heavily on reinforcers. But too much of dependency on reinforcers, or if these strategies are not implemented systematically, we may end up having severe problem behaviors. We sometimes also quickly identify the reinforcers. Or maybe sometimes in some cases we generalize reinforcers. We think that sweets are going to be preferred for every individual, and then we start offering candies. But that's definitely not the case, right? We need to really, really take the time to identify the reinforcers. Observe the child. As a clinician, as a practitioner, I can tell you, the more time I spend on assessment, the better results I get in the long run. Improper use of extinction. Behavior is often targeted for reduction without adequate shaping strategies. So when we work on decreasing challenging behaviors, it is crucial to work on increasing skills. The skill deficit needs to be worked upon as well. But sometimes planning is made in such a way that you work on the extinction of problem behaviors, or extinction procedures are put in place, but you're not looking at also shaping the skills that are necessary to help serve the same function of the behavior. So these are some of the contributing factors to severe problem behaviors. I just want to quickly introduce practical functional assessment, skill-based treatment, which is an approach developed by a BCBA, Dr. Gregory Hanley, in collaboration with his colleagues at First Things First, FTF Behavioral Consultation. For more information, you can visit this link, the website address that I've provided here. And what it is used is it is an innovative and compassionate approach used primarily to assess and treat severe problem behaviors like aggression, self-injury, or elopement in individuals with autism or intellectual disabilities. PFA is a safe, efficient, and effective method of identifying why problem behaviors occurs. It is conducted in a naturalistic, non-aversive, non-triggering, non-aversive way, meaning not triggering unsafe outbursts, and it focuses on understanding the social significance behind behavior. Why escape occurs, why access to attention, why access to tangibles. We try to completely understand the profile of the behavior that is presented before us. So I want to also add here that in the traditional ABA method, we are moving away from that, and this is deemed as a new ABA method. And in the past, we used to do functional assessment interviews, we used to do functional behavioral assessments, and we used to observe the individual. It was an extensive procedure to get started with the treatment. Here, we are able to get to the function within 30 minutes. 15 to 30 minutes is what it takes to identify the function. That being said, ongoing observations are always in place, and ongoing changes or modifications to strategies being used is also ever in place, because we are following the individual's lead, the child's lead. We are not coming with a set of ideas or knowledge from the textbook to be working with this child. What is skill-based treatment? It is a positive reinforcement-based intervention that teaches communication skills. I would like to overemphasize on communication skills for an individual with autism. Before any other skills, we want to work on communication skills. Now, communication skills to mitigate behaviors is what I mean here. There should be a mode of communication that every child has to be able to tell you what they want or don't want. We then work on tolerance, how to wait or accept a no. We work on cooperation, meaning following directions, and the behavior is shaped gradually using fun and safe interactions, often called happy context. Here, emphasis is on keeping the child very happy, relaxed, and engaged, no matter what they're doing. If they are engaging with reinforcers, we want them to be in HRE. If they are engaging in skill-based treatment or developing skills, then we want them to be in HRE. So please bear that in mind. I'm not going into the depths of PFA SBT in this program, because we are in this session only because we are touching on managing severe behaviors and how to mitigate or how to ensure that you don't get to that place, how to turn off the behaviors. What are the things that turn on behaviors? How to turn off behaviors? That's what we're going to learn about. And before treatment is in place, or while you are, designing the program for the child around the PFA SBT method, we do something, or we put something in place called universal protocols. So PFA and SBT process starts with universal protocols based on what we know about why problem behavior occurs, what can we do before or while skills are being developed, and this is in order to eliminate severe problem behavior. Now, the big question, do we even know the answer to why do individuals engage in problem behaviors? There is a combination of reasons to this. We need to understand that. There is no clear-cut reason that you may come up with just because it is written somewhere that this child is engaging in problem behavior because of this. Every individual is different. Every child with autism, if you know one child with autism, you only know that one child with autism. Please bear that in mind. And the more you get to know this child, the more trust is built between this child and the adult that is interacting with them, the better for the treatment. Please bear that in mind. So you cannot really pinpoint the reason because there's always a combination of reasons because of which they engage in problem behaviors. By default, we know most of them have difficulties with communication. Some of them are nonverbal. That itself is a reason. So if you just tell me, oh, he wanted the candy and he did not get it, that's why he's engaging in the behavior, that's not true. There itself, we have multiple reasons because the child is nonverbal. He doesn't have a mode of communication to tell you that he wants the candy. He's reaching out, you're not giving it to him. And you are on your phone, for example, and that again is another reason because the attention is divided. Your attention is not available for the child. So they are engaging in a problem behavior due to a combination of reasons, which I want us to be able to identify. Sometimes it is to access something, sometimes it is to avoid some things, such as tangibles, attention, demands, and most of the time, there is no clear and cut answer to this. All reasons may never be known. Please bear this in mind. Interviews help inform some of the potential reasons. Interviewing caregivers, teachers, therapists, and anyone who engages with the individual on a regular basis must be interviewed to arrive at a potential cause. I mean, like something that we can work with. We kind of have a profile of this individual to work with. This provides us with a synthesized reinforcement contingency. So in our new program, what we call as a reinforcer in the past is now known as SR context. SR is because multiple functions are in place for which the individual is engaging in problem behavior, we do have a terminology called synthesized reinforcement contingency. What should we focus on? When managing severe problem behaviors, the focus must be on the here and the now, because right now you're dealing with it. Right now is when you need to do something about it. You need to question what just happened now. Of course, you're going to look into that. Now we need to also focus on a safe and socially acceptable way to mitigate this behavior. What is the individual's behavior telling us? Ask questions. Try to please be in the individual's shoes. We are promoting empathetic approach to treatment. We want to be compassionate. It is not about me as a professional. It is about the child that I'm assigned to. This is the person who is unable to communicate. This is the individual who is trying to get my help. I'm here to support them. I'm not here to show my skill set or any degrees that I've had or any teachings that I've had. Right now, who are you with? What is that child telling you? What is their behavior telling you? What do they want? Do they not want to do something that you're asking them to do? Or do they want to do something of their choice that you're preventing them from doing? Is there a certain way that they want you to behave? For example, in most cases, we are all busy and sometimes, the child is near you, standing right there in your face, but you are on your device, for example, or you are in conversation with someone else, and you are missing the fact that they want you to attend to them, but you have other things to do. Then there is a precursor that has already been set. Now you need to ensure that this behavior doesn't get escalated. So you need to be available with your attention. That is important. Can we just make can we just make it available, whatever they want? Can we make it available to them right away? Some questions to focus on. But I'm now getting to the strategies that we use in universal protocols. Please remember, our goal when working with severe challenging behaviors is number one is safety. Safety, the child safety, the peer safety, safety of adults working with, everyone's safety, safety of community members, whoever they're going to interact with. Televisability, meaning dignity. If the way you're handling the child or individual engaging in challenging behavior is put on TV, will that be okay? Is that something everyone can watch and be okay with? Will it appear ethical? These are the questions we need to ask. We really need to ensure safe, televisable methods or strategies that we use in order to work with severe problem behaviors. The most important thing in this is building rapport. You should never, ever get to a point where the child cannot trust you. Rapport is building before even any other thing, any intervention is introduced, is crucial. What are the goals using the universal protocols? What are the goals here? We want to increase student joy. We want that child who comes to my center to be coming because he wants to come, not because his mom is pushing him to come, not because someone's, forcing him to come, right? So we want to increase the student joy. We also want to prevent escalation to severe problem behaviors. We want to teach students that the staff are there for them. Your undivided attention is important. They need to know that. We also want to increase staff job satisfaction. Why? Because there's a lot of turnover, big major turnovers in our fields. Again, it's the challenging behaviors that poses a risk to the individual. It may not be even the individual. They may have family members preventing them from going there. I have heard so many things. I've heard a young therapist of mine telling me that their mother-in-law asked them to stop working because she was focusing on having her own child, and working in such a center may result in she having a child with disability. So individuals are not made aware, like family members are not aware, and as a result, the job satisfaction is poor, the turnovers are high. So these are the reasons we are introducing this protocol. What do we know of universal protocols? How? What is the preventative approach? How can you prevent severe problem behaviors? We need to again go back and ask questions to ourselves. Are you someone who is showing continuous positive regard and empathy with the child that you're interacting, with the individual that you are interacting? What does that mean? Appear positive, confident, caring at all times. This is a vulnerable individual who has been assigned to you. They have difficulties with communication. They have anxieties. They have issues that you will never come to know of. They do not sleep well. They have issues voiding. Their bowels movements are not regular. They're constipated. They are someone with severe sensitivity to many things, severe sensitive issues. So please bear in mind, it is you they are looking up to. You as a parent, you as a teacher, you as a special educator, you as a therapist, a clinician, a doctor, whoever you are, please make sure you're giving a continuous positive regard and empathy to this child, appearing positive, caring at all times, making clear while you're interacting with them at least that you're totally available to the student. Please don't appear distracted. Please let them get the feeling that they matter. You're there for them. Their behaviors that is trying to communicate something to you matters, and you want to understand it. You are showing the empathetic side of you. Provide non-judgmental listening to them. For the ones that are vocal, verbal, and they are able to communicate in words to you, please restate the assertions and declarations to convey your understanding. I hear you. They need to know that. I'm hearing you. I know this is how you feel. I know that when something is not available, this is making you upset. Talk to them and give them that respect. Give their feelings that respect. Show that, you are not judging them. and you are actively listening to them. The second protocol in this approach is enriching the environment. Like I started by saying, we have a synthesized reinforcement context that we work with, meaning to say it is not just one reinforcer that we are depending on. We have identified multiple reinforcers and we make it all available to the child or the individual. So ensure multiple preferred activities are available. Rotate and vary activities because you don't want boredom to set in. Facilitate a shared experience versus a supervised experience. This is another thing I want to emphasize on. Many a times we bear the hat of a professional and a know-it-all person. And if we do it inadvertently, we are not doing it on purpose, we just come across to this individual that we are supporting as though we are supervising them, as though we are the boss, as though they need to listen to us. But that should not be the case. It should be a shared experience that both of you are part of. It should not be you have the upper hand and that the individual is below you. It is important to follow the student's lead to the extent possible, as far as possible. Please, they teach us a lot. We are continually learning from them. Please bear in mind. Field is also evolving with time. We are learning more and more about our individuals on the spectrum, and we really need to be mindful of following their lead. We need to be mindful of acknowledging what is it that they're asking. If the child is wanting to wander and explore within dangerous boundaries, please do that. Please allow them to do that. Supervise in the sense, monitor them, ensure that they're safe, but you are not going to pull them back to sit at the table because that's what you want to do. So it's them versus you. So it is client-centered. It is centered around the child. It is centered around their lead. You are following their lead as to the extent that is possible. Please answer all questions that is asked by them, even if they're repetitive. Sometimes we end up feeling like, oh, it's the same question. I have to ask it 10 times. In order to mitigate or in order to ensure that behaviors are not turned on until appropriate skills are developed in the child. So please bear in mind, this is not the end goal for us. This is the beginning. We are trying to build that rapport, that trust. At that time, you need to be available to them. If they ask you 20 times, please respond to them 20 times. Honor all reasonable requests, verbal or non-verbal, even if they are repetitive, and do so genuinely. Please do not just do lip service. Kindly be, you mean it. When you say something, please mean it. That is important because they are hypersensitive in every way. That's my experience. They do read your emotions. They do read your intents as well, I feel, because they are able to say when you are upset, even if you're putting on a smile, you're upset or you're, angry for some reason, they are able to see that and they even communicate with them. Are you okay, Miss Simmi? So many times one of my kiddos would come and talk to me because I would be smiling, but I'm not. I'm dealing with so many other issues that they're able to sense. You also need to invite the student to participate in scheduled activities. What am I trying to say here? What does scheduled activities and invitation mean? Give me one. So many a times we depend a lot on visuals. We depend on visual schedules, mini schedules, visual supports, and we think that, because the schedule is there, that is giving a structure to this child, and that's something they should be sticking to. Here, we are suggesting, and I'm again telling you, it is a very effective practice to not necessarily expect them to comply with the schedule that you have prepared. You prepare a schedule and you invite them to join. They may or may not be ready to join, because this is a skill that you're going to teach later. But in the initial days, when you're building that rapport, when you're aware that there is this is a individual with a profile of severe behaviors, you want to ensure that you're not shoving anything down their throat. You are actually just telling them that this is available and you may join. And also, please use the daily schedule, but consider it as a guide. It is important to follow the student's lead and reference at all times. We also want to be at this stage limiting non-essential demands. What does that mean? That which is not required. For example, if you have math and English and visual performance activities and some of those academic activities scheduled for the child, he can do without them. He can do without those demands for that day. You can simply ensure he's eating. You can present that demand to him. It's lunchtime, you need to eat something. And even with that, he may or may not want to participate in the eating. So please follow his lead and limit the non-essential demands. Essential demands that you set up forward to work on, such as for a child who is toilet training, it is essential for me to ensure that he makes those visits to the toilet. So that is an essential demand. But for him to sit down and do some coloring with me or do some writing with me, I can do without it. So those are not essential. Those demands, I will limit them. You also need to, at this time, limit instructions. You want to ensure that you are following the child's lead and you're giving them that space and that understanding that you're there to support them, that they can trust you, that they can depend on you, that you're available for them. You also need to limit questions unless following the child's conversational lead or if questions are preferred by them. So if they are engaging in a social bid, for example, they are asking you to join in a conversation, they're asking you questions. Yes, go ahead and respond to their questions, but do not throw in your own questions during that time. Respond to them, respond to their conversational initiations, but don't start expecting them to maintain a conversational topic or answer your questions at this time. Do not attempt to limit or redirect motor, object, or vocal stereotypy. What does this mean? If they are engaging in stereotypic behaviors, such as repeating something, repeating phrases, or repeating what you're saying, or if they're rocking, or if they're moving their hands, flapping, anything that is repetitive, it's okay. We can live with it. There is no need to limit or redirect it or to stop it from happening. Because remember, in this phase, your main objective is safety, televisability, and building that rapport. When presenting essential demands, you make them less aversive. Consider first whether the demand is truly essential and omit it if it is not essential. Provide choices prior to the demand. Offer materials to complete the task without issuing a demand vocally or providing non-directive prompting, and provide as much support as needed for the client to be successful and to consider the shared experience. So what does this mean? You need to ensure that if at all you're required to present an essential demand, please do not make it punitive. Please do not make it aversive to them. Use a tone that is loving and caring and empathetic and compassionate. Do not command. Do not come across like you're the boss, like they have to follow what you are saying. Or watch your tone, watch the voice volume, watch the way you are presenting the demand. Do you want to join me to do something? As opposed to, come, You have to come with me. Let's go, you know. So changing the way you're presenting the demand is essential. In addition, you want to also offer choices prior to the demand. So if I am supporting a child, which you will see soon, some videos that I'm going to share with you, to ensure that he goes to the toilet, or sorry, to the washroom when he has to move his bowels, I'm not going to say, let's go, time for washroom. That's not what I'm going to say. What I'm going to say is, are you ready? Do you think we can walk? Do you want me to walk to the washroom with you? You know, like tone down, maintain a low profile. Laying low and loose is going to give you so much more than high and, you know, uptight or in a commanding position. And again, when you are offering materials, you should not be issuing a demand or providing them with, vocal instructions. Instead, do non-directive prompting. What does this mean? You want to be, I have a sheet that I'm coloring. Give him the sheet. You can do the same, you know. Like I'm giving a very non-directive prompting to him, as opposed to, your turn, you sit down, you have to color. No, you may join if you want. It's your choice. And the support needed should be as much so that you always can bring back those shared experiences. And you'll see some videos which will help you understand what I'm talking about here. What happens when you see a problem behavior? Now, we talked about how you can turn off behaviors. What are some ways to not bring them on? What are some antecedent strategies that you could have in place that your trust is built, rapport is built to the point that we are not seeing problem behaviors? But the first instance of problem behavior or indication that their problem behavior is likely to occur, what are you doing? You need to ensure. That is where you ask the question of now and here. Why? What does he want? Why is he engaging in the problem behavior? Very simple questions. It is honestly not rocket science. You just have to be aware. You have to be mindful. You have to ask these questions. What does he want? Is it something that he can have? You need to see if all his reinforces what he is seeking, the reason behind him engaging in the problem behavior. Is it something you can make it available to him? Acknowledge the communicative intent of the behavior empathetically. I know you really want that. And then you terminate any existing demand, expectation, or non-preferred interaction. Now is not when you say, no, 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 you can't have it. And then 5 people coming to hold him down, to pin him down, to sit down. Trust me, these things happen. And that is the way it has been, because people don't know when problem behaviors are happening, how to deal with it. Sometimes parents do it, sometimes therapists do it, teachers do it, because there's no other way that we're aware of. But instead, if you just take one step back, take a step back and ask yourself, what does he want? Is it something I can make it available for him? This is definitely challenging many of our old school thoughts around challenging behaviors. But let me tell you, when you are working on building skills, this is essential. You need to ensure safety. You need to ensure televisability. And you need to ensure rapport and the trust that needs to be built between the professional and the student. You need to acknowledge the communicative intent. You need to terminate any existing demand, expectation, or non-preferred interaction, which is something that is aversive to the child. Saying no to the child is aversive to the child. Asking the child to wait is aversing to the child. Holding him, pulling him, saying that, no, 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 you can have this. At that time, when he's in the escalation mode, when it is slowly escalating, you cannot really ask him to calm down because he's not hearing you. He really wants it. So please be mindful of that. Give him some space. Do not be in his space. Do not be in his face. You need to be, at the same time, continue to be available to them. Meaning to say, don't just leave them there to calm down on their own and leave away. Do not do that, because they may need you. They need your attention. You need to monitor them. You need to ensure that further problems are not occurring, that everybody is safe. And most importantly, you need to be available for them. What if they need some help? We don't know the reason of the behavior. So do not leave the client at that time. Provide access to any tangible activity reinforcers that are or were available. Meaning to say, what is it that can bring the behaviors down? Think about that. Can you quickly go grab those items and make it available to them for them? Because we don't know. We don't know. Like I said, there could be so many reasons they're engaging in the behavior. Listen for any requests made by them and attempt to satisfy them. Document the interaction that preceded the problem behavior and the type of problem behavior and the events that, when removed, provided and stopped the problem behavior. So if you thoroughly know your child, if you have made those minute observations about your child, you will be in a position to understand what could be removed. Many of our friends have sensory sensitivities. So maybe something in the environment is causing them to trigger and have this behavior. Or removal of something. Maybe a music was on and you stopped it. But you need to know. And that is where identifying the reinforcers are critical. Do not work through minor problem behaviors, nor should planned ignoring be used. Listen to what the child is communicating and respond accordingly. What does this mean? We have differentiated problem behaviors into minor and major, or minor and severe. So what happens in minor behaviors are, you will start seeing precursors. You will start seeing signs of escalation. You need to be mindful to catch them. Again, if you know the child really well, being in their shoes, being empathetic with them, you are likely to know if my student grimaced or if they put their hand on the face like that, that means they're thinking. They're thinking about something that they haven't received, and now this could escalate. This is where I need to intervene. I should not wait for a major behavior problem to take place. So it is very important not to work through minor behaviors. Neither should you ignore them. Oh, he's just like that. You know, he will just come around. We don't do that. If you are entrusted with the individual with severe problem behavior, it is your job to completely, thoroughly understand the profile of this child. What is it that you should do? What is it that you should not do with him? What are his likes? What are his dislikes? What are the variety of his likes? He likes mom being present during session. He likes hugs from mom. He likes to eat chips. He likes to engage with water play. He likes to roam around. He likes to swing. I know it all. And I can make these things available for him to see, hey, which way can I handle the behavior as opposed to laying my hands on you, as opposed to pinning you down, as opposed to pulling and pushing you, as opposed to raising my voice, reprimanding you. I'm not going to do anything aversive. So those are the 7 protocols that I wanted to share with you. I also want to share some of the ways in which you can strengthen the rapport with your student. Children cooperate better with adults with whom they have good rapport. I really, really want everyone to take away this. And this is true for any parent. It is not just for parents with children, with autism or special needs or anything like that. We all need to be parents who have a good rapport with our child, who knows our child really, really well, because that is when you're going to get cooperation from them. Compliance is short-lived. They're doing it because they're afraid of you. But cooperation is something that is going to go a long way. You need to commit some quality time with your child. You need to make plans that you can achieve. Be realistic. Don't make huge plans and not be able to do it. In 1 month's time, we are all going to go for a vacation to a really, really far away place. God forbid something happens, it's not going to, you're not going to achieve it, then your plans were not achievable. Instead, you need to make plans here and now. Give them that quality time, that undivided attention. And whenever you're ready to play, put out some things that the child likes to do, not just one thing. Have multiple reinforcers available. Make yourselves fully available. Sit close to your child. Let them see you. Let them see that you are right there. You're mirroring in your body position. We are sitting opposite to each other. Turn your body towards your child. Show interest in them. Genuine interest is what we are looking for. Pay close attention to them. Follow their leads. Be appreciative. If they smile, you smile back. No prompts required at that time. No requests made. Lay low and loose. Be available for them. Know how to avoid the challenging behaviors. You need to think. I want to ensure that my child does not engage in severe behaviors that are going to be difficult for me to handle. So I need to pick my battles. What is it that I can really make available to them? And later, I'm going to work on the skill deficits that they have, but not at this time, not when there is a behavior problem, going on. Do not try to correct or teach your child, try to teach during this time when you're working on building the rapport. Asking questions not required. Every moment during the rapport building time should be child-led time, should be you there for them, should be they teaching you about them, not you wanting to teach them, cram them with all this information that you want to share with them or all this knowledge that you want to give them. There's a time for that. That's going to come later, okay? Compliments are a must. Shower them with compliments during this time. How happy you are spending time with them. Please let them know that. And sometimes it is okay to be quiet and wait. That is also a possibility that maybe they don't want to interact with you at that time. Be available. No need to say anything. I want to quickly present some videos for everyone's, just to get a perspective on how we worked at my center in Canada, Precious Soul Services. I want to acknowledge the efforts put in by parents, Nazia, Sultana, and Dad Ali Shabir Muhammad, who have kindly given me the permission to share the videos of their child, Ayman, who is 11 years old, and he does not like to sit on the toilet to void. And one of the main goals that we are working on is toilet training for this child. And this is a child who came to me through, referred by a school in Ontario. And he had a severe history of severe challenging behaviors. He was on medication at that time. And I will tell you what some of the challenging behaviors that we have, seen in him. He can hit, open palm, punch, pull hair, pushing, biting, hair pulling, pulling person, pulling hair, head butting. So he would come like this, or he can go like that, and mom's been hurt multiple times. Therapists have been hurt in different ways, scratching. I probably could not remember everything that we have had with him. So scratching, pinching, throwing objects, destroying objects. All this was his profile when he first came to us. According to his IEP from school and the observations at the clinic, the frequency of the behavior was daily. Some days it could last only for a few seconds, and other days it could be an entire day. Okay, so we have to remember the family has been very, very involved with him, extremely dedicated family, very supportive with every process that, they have been so patient. They come and sit in and be a part of the treatment. This this could just not go anywhere else but towards progress, okay? And remember, because we are working on getting him to the washroom to at least void in his pull-ups and not necessarily sitting on the toilet right away because that is unrealistic, he still would engage. Just going to the washroom is something he did not want to do. He's in his pull-ups. He can do his business in the pull-ups, but he still was looking for corners in different rooms in the center. He has severe fixation on past events from the home. Medication changes were also causing a lot of havoc. He's unable to communicate his needs. He does have few words, but he doesn't necessarily use them. Demands being placed was difficult for him to handle. He would not want to comply. He's a very my way person, wanting to have his way. Overstimulation impacted him, not ready for transitions, and when allowed, fixation on completing an activity for which there is no time. Okay, meaning to say, if he has started coloring and we have given him a really big page to color, he has to complete that page before he can drop the color crayons down and leave. And that would interfere with everyone's timings because he needed to be in school right after therapy. So first thing that we did is identifying, as I mentioned before, it is very important for us to understand his reinforcers, understand if left alone, what is it that Ayman likes to do? His happy, relaxed, and engaged state. I have to also acknowledge really wonderful therapists that I have at my center who have done a fabulous job in bringing this child around. So let's get started. So he's holding on to some of the
I told it. No? I mean, do you want more? Okay, I mean, all done, not available. Okay, have you wait?
Okay. That was a little bit, that was one of the methods that we use, known as interview informed synthesized contingency assessment, ISCA, in which we try to place a demand and then we see what the reaction is in this child, right? And based on that, we define what are precursors. When should we stop placing a demand, right? So that was what it was. So based on ISCA and the observations and the report reviews from schools and doctors and different professionals, this is what we identified as his synthesized reinforcement context. He likes drawing, he likes coloring, he likes baking, he likes cooking with mom, water play, music videos, edibles, especially chips. So the initial few days, what we do is we allow him to engage in what he likes to do.
Let me do it. Thank you. But let me do it.
Okay.
Let me
I'll
do
go
it.
So now he is into baking, and it was easy. It was not difficult for me to make these things available for him, because we are invested in spending that time with him to be able to achieve our goals. And the parents are on board, and we allow him to bake because that's what he wanted. This is the stage when we are building rapport with the child.
I'll wait for the timer now.
Okay, now is when intervention began, and we attempted to put this schedule here. Let me see how long this is. So look at, when I talk about positive, giving that positive regard and waiting for the child, being available for the child. I want you to see, I'm just here to help him. I'm here as a help. I'm not here as a therapist for him. I want him to know I'm available. Whenever you need me, just let me know. And then now here, okay, I want you to see. Have you all done? Okay, so he is constantly seeking chips at the center. Open. So what I'm doing here is helping him see if chips are available, because this is an essential demand that I'm trying to place, that, hey, we are not going to be giving you chips. For a chip. We have chips in here. I'm helping him. He has an agenda. He's looking for chips. I'm helping him look for the chips. Let's see. Oh, I'm not losing anything. I'm keeping him happy, relaxed, and he's engaged in what he's doing. He knows I'm there for him. Let's check. Any chip? No chip in here. Let's check in here. Any chips? No chip in here. Can I put this back? Chip. Okay, let's keep looking for chip. I'm gonna put this away. I'm kind of giving him the idea. Put away the back. Then I'm going to help you find chips. No chips. But I also know that chips are not available. That is the message I want to give him. Oh. It's, yeah. You want that? You want that? No. What do you want? You want me to check the bag? I can check the bag for you, okay? Let's check the bag. Do we have any chips in here, Ivan? Let's check. Oh, do you see any chips? No chips. Sorry, Iman. So here I'm sharing his feeling. I've told him what he's looking for, and I'm showing him that I'm available to help you with this. And I'm also saying the way he's feeling by acknowledging that I'm sorry, you're not able to find what you're looking for. But he was persistent. But remember, he's a fixated kid. He's very fixated. No chips, right, buddy? Oh, this doesn't have a key, Iman. So we are being honest here. We're not trying to control anything. We are giving him the control. You go ahead, look for chips. Because this is in the long run. Chips in that bag, Iman? I want you to tolerate. That is why I'm introducing this right away. Do you want watermelon? Now I'm offering choices. So chips are not available. No? What else do you want? No? Okay. Yeah. Now he makes up his mind. I'll take you. You want to go check for chips? Let's go. We're going to look for chips. Then he changes his mind. That instead? Awesome. See, he changes his mind. Come over here. Come. Sit down. Wow. We can sit and have yummy. I'm going to watch this spoon and be right back. I'll be right. So here he's waiting patiently.
We're waiting for the spoon, okay?
Waiting patiently. This is a child by now. If I said no to chips and I said, hey, sorry, tone that was different, we would have gotten hit, scratched, so many things would have happened. But I showed him I'm there for him. Oh, that looks yummy. See? She has seeds in it as well. Wow. Okay. So here is when something is not available. How do we set limits? Okay. And what do we have here? So this is how we were blocking, certain settings so that he doesn't go in there to void. Instead, I think this became like so big. These are the initial days when we really, really just have to follow their lead. What happened? What happened? Yeah, let's go back and do some coloring or some math work. We like it. We show you what happened. Okay. Giving that positive regard, following their lead. He's checking everywhere. Trust me, this child has so much fixation with what he's actually asked for. And this may end up like in severe problem behaviors. Now, he's found an empty packet of chips, which was a problem, but then we worked around it and we redirected him to his own lunch and snack bag. Now all the empty, this is another day. Yeah. Trust is being built here. Trust me, this works. Now there is no chips asking, there is no questions, around any problem behaviors. We are only working focusedly on the toilet training. Look at that, he's laughing now. He came to a point where he started laughing. It's all done. Yeah. He found some crumbs. We have your snack bag. Some good food in it. Let's go. Let's check what do we have. Your snack bag, lunch bag. That's his mom. Okay. Now he's willingly coming, cooperatively coming. Fixation for the chips is over. Now he's coming to have his snack bag, and here we help him.
It's the blue one.
Yeah, I got it. big smile. You okay. So all his social bids I'm honoring, respecting. I'm giving him what he's asking for. And you smile. That's it. Okay. What to do? He doesn't give up. We have done a lot of rounds looking for chips, but we have accepted now that it's not available in this facility, and he is okay with it. Okay, here we are showing a little bit of the shared experience. We are not forcing him to come and do anything, but modeling it to him. In case he wants to join in, he's welcome to join. This is for you, okay? You can write your name. I'm writing mom's name. N-A-C-I-A. Nazia. Ivan can write his name if he wants, he can write his name over here. Yeah, I mean, want to. This is where we can write your name. A Y M. Look at this smile. Those are the things that I would go by. He's really cooperative right now. M A N. Hi, man. This is mom. He's paying attention. He's coming on his own. This is dad. Ali. Ali's dad. And then we have I'm probably spelling it wrong. C-A. No? A-Y-E-C-A. Okay. All right. Let's do this again. A-Y-E-E-A. Isa. We're missing one more person. Who are we missing? Yes, I'm going to move forward. I think for the sake of time and questions, this is again shared experience. Like if you want to, you can join it, right? That's the idea. If you want to do this, you can come. Now he's interested, he will cooperate on his own. No force, no demands placed, no instructions given. Happy child coming to engage on his own. Okay, here again, I think this is the last one. Or one or two. Oh, I do get a hit here. I wanted to show this to show how to, when you get a severe problem behavior or a hit or something like that, what is the way you should be? You remain calm, you remain, as though you're not impacted, and you continue to show him that you're there for him. You continue to, this is one of the days with his face like that. He's already upset that he couldn't find the chips, because this is where we are setting limits with him. So now, within a few minutes, he decides that he is really upset. I'm redirecting because he's sitting and thinking too much. I was thinking maybe he'll be interested in doing something else, but instead he stands up. I know there's a lot of Patience needed. Okay, hopefully now. Yeah, he's already, these are the precursors. The hand on the face, the whining sounds, the clearly appearing to be upset. I don't know, he did something in the air, which I didn't understand. Look, now is when we're going to have a severe behavior. Why? Okay, so still you really need to remain calm. You really need to follow his lead. You really need to continue to help and support. Now we have achieved, we have come a long way. This is a success, with mitigating all problem behaviors, cooperative, engaging. Ayman. To be available, offer help. Narrate what they're doing. Show that you're interested. And at this point, I was completely able to help him follow a schedule, which in the beginning I did not, but eventually, cooperatively, I was able to. Perfect. Okay, here you go. That goes in the garbage. Look at the trash. Yes, this is your chip. Put that in the trash first. This is something he got from home, and that's why it was made available to him as a surprise gift. After learning not to engage in, and to be able to take no from us, he eventually started bringing chips from home and engaging with. Let's try this. More? You want more? Let me see one color. They sit down. So I'm able to teach him toleration as well. You need to just color. Yeah. See, just very basic, some small instructions that you gave, and you're expecting him to follow through with it. You did it. Give me a high five. Wow, you want it's time for coloring. Yeah. Match. I like to. That, I guess, brings us to the end. Basic. So basic. Question answer time. I want to be mindful of time. Thank you, everyone. Thank you all for being patient. Our field is all about being patient, and we have gained a lot from them. They've taught us a lot. I'm very grateful and thankful. Thank you. Yes, Alokji.
Yeah. So we request you, if you have any questions, you can raise your hands, or even you can type the message in the chat box. Anyone, please. So before we'll take the questions, we have one questions already in the chat box. Isha Sharma, are you there? Yeah, you can ask your question, or Simmi, you can read that question. Yeah, Isha. Yeah, please.
Yes, I am here. So
Yeah,
my
please.
question is, my son, he's 12, almost 12.
Okay.
And the thing is, till now we have been taught to actually avoid the problem behavior, or to help to hold back on the reinforcements.
Okay.
If for supposedly he asks for all the junk food and he'll start throwing things or hitting.
Mm-hmm.
So my question is, if I keep on giving him reinforcements,
Right.
would that not increase the problem behavior? That is my concern.
Yeah, good one. Very good one. And it's the most relevant one asked about this new approach. Like I gave you the disclaimer right from the beginning that this is in place as a bridge. It is like before we start the treatment procedure, right? Before we go to the place where we need to teach him to tolerate, before he learns to relinquish, before he accepts no from us. Demand, denial, and delay. These are the three things our children usually have major issues with. So, Isha, I again mentioned that in the old school of thought, we were right away getting into procedures, right away saying no, without recognizing the the child's ability to accept that no. So right now we are putting another step between treatment and the first time that the child comes to you. So during that time is when we need to work on building rapport. See, just giving him the reinforcers when he's asking for, before you engage in proper therapeutic interventions and building that trust. I want to ask you, Isha, do you think your child trusts you as a parent to be, giving him or making things available that are really reinforcing to him? What do you think, Isha? If I could see Isha's face, I think she's,
Yeah, she's here.
Yeah.
she's here. Okay.
Yeah.
Go ahead.
Yeah, I'm not able to switch on the camera. Yeah, the thing is, yeah, you are right in asking that question, because I do feel that I have not been very regular with my approach. Sometimes they are available, sometimes I just refuse. So I do feel that, yeah, he might not be able to trust me, whether if he asks the question that he has explicitly been taught to ask, and if the thing is not appearing, yeah, I can understand that he might not be able to trust that. It's just that I get very tired of the repeated requests for junk food all day.
Okay. I completely hear you. I completely hear you. If that is an essential demand, if that is something you want to limit, if junk food is something as a parent you decide, I can make, what are other things that you can offer him? Have you thought of that? Do you have a list of other reinforcers that you can present to him as a choice? If that is there and you want to limit just the junk food, then we can come up with a plan wherein you are setting limits with just the junk food, but anything else that he really likes to eat, you can make it available for him. Okay? But then even when you're setting limits, you want to do it in an empathetic manner, in a compassionate manner, understanding that. Can you tell me, Isha, how do you say no to him? What can you give me an example of, the way you say no to junk food to your child? And what's his
Yeah,
name?
sure. Yeah, his name is Rudraj.
Rudraj? Okay.
Yeah.
How old is
So,
Rudraj?
yeah, he's 11 now.
Okay.
He'll turn 12 in August.
Okay. Okay. So how do you
So
say
the
no
way,
to Rudraj?
so just like the child that was in the video, similar is the case with him. He'll start whining and he'll cover his face, and he'll start saying, "I want ice cream. I want ice cream. I want chips." And then I'll just say, "No, Rudraj, this is not available."
Okay.
And sometimes he repeats so much that I'll just leave the room. I'll go out of the room, and he'll just calm himself down, and then I'll come back into the room, and then maybe we'll do another activity. But
Okay.
then the crying session starts and it goes on for half an hour.
Okay. So now, is Rudraj, is he fed enough? When does he ask you? What time of the day? Has he had his breakfast? Has he had his lunch? Has he had his dinner? Like before he asks you for these junk food, have you ensured that he's had sumptuous, meal? Is that something you're doing?
Yeah, very, very good question. Actually, I have noticed this myself that he needs to eat something every 2 hours. I was, just giving him food like we used to have breakfast, snack, lunch, and
Yeah.
a late dinner. But he wants something to eat every 2 hours.
Okay.
And
Okay.
and after eating, he
Yeah.
is in that happy, relaxed, engaged state that I just got to know about. So
That's awesome.
that is
That's awesome.
his, yeah. So I do feel that he needs to eat something every 2 hours. Actually, yesterday only I started doing this, and I was like, oh wow, the behavior is not that much. So yeah. So this is a very good question. It just reinforces my belief that whatever I found out yesterday
Yeah.
is actually true. The requests were not that much, that many. Yeah.
Awesome. Isha, this is what I can say because, just respecting the time limit, I am available to support you. You can take my number from, I mean, I can put it in the chat box for everyone
Yes, yes,
if you
that
want
will
to
be good.
contact me.
Mm.
Are you
Even
in
email is
Odisha?
good.
Where are you? Where,
Thank
Isha?
you so much. I am in Jaipur.
Jaipur, Jaipur. So, Isha, I want you to start with this. You have already made some observations about your child, okay? And I want you to make further such observations. One of the observations you made is, oh, wow, he's happy, relaxed. And, you, without even knowing all these things, you followed his lead. You identified what is it that is making him happy, right? So, this is where I want you to continue to do that and make a list until we chat again, right? When you contact me, I will further guide you how to go about this particular issue. I'm more than happy to do that. We can contact
Mhm.
via WhatsApp because I'm leaving tomorrow to back to Toronto, but I will be available via WhatsApp. Okay, so I'll put my number here, and then we can take it from there. But I want you to actually put down your observations. I want you to continue to observe what is his happy and relaxed and engaged. Okay?
Excellent.
So
Thank you so
yeah,
much. Thank you.
Very
then
welcome. Let me put down my number here for
yeah,
everyone and my email ID as well. Keep going if there's any more questions.
Rajni ji, you can ask your question. What your my son is recently 18. He started spitting on face. Yeah, Rajni ji.
Yes, sir. Can I ask? I'm Sunita.
Yes, you can. Please carry on.
Okay. So, ma'am, I'm practicing as a special educator,
Okay.
and the child is has been coming to me since for the remedial sessions since 3 or 4 years.
Okay.
Right now, he's in fourth class.
Mm-hmm.
Okay, since class three, she has been taking sessions and no such behavioral issues and all.
Mm-hmm.
She's very good now. She's improved a lot. She comes, in the top 5 students in the class. But the problem which I have been facing now is that one day her mother told her that now you are a grown-up child. Okay, you
Mm-hmm.
don't need anybody's help, and this thing, that type of conversation. I don't know the much about that conversation, but that time onward, she denied to came to me, and she was saying that now I'm a grown up, I know everything.
Mm-hmm.
Now I don't want to take any session because I have improved a lot and I can do on my own.
That's
Okay.
good.
Mm-hmm.
And whenever she saw my face or me in the corridors, and she ran away from there.
Okay.
And but her mother still wants that she comes to me for the sessions, and for the social interaction session. How can
Okay.
I make the child come comfortable to come to me?
So during the so what I'm hearing is the child is coming to you for social interaction sessions, social group sessions, or
Yes, ma'am.
individual.
Yes. Once in a week, we have a group session where we
Okay.
give them a situation, real life
Yeah.
situation where they have to act, okay, how to communicate with each other.
Okay. Okay.
A mother still wants, but the child is denying.
Okay, okay.
So what should I do now?
Okay. So, and your history with this child from how many
Class one, ma'am. Class one to
class?
third. She has been coming to me, and she
Hmm.
was very comfortable with me having her sessions with me.
Yeah.
But one day she has a confusion. Mother said that you are a grown-up child now. You can do everything on your own. So
Okay.
now she's saying, "Ki now I'm a grown-up one. Please go and take the sessions of the younger students who are younger
Ah.
than me." So
But
she was
now again, mom
advising.
wants to bring her to you,
Yes,
right?
and even she is referring students from her class who was
Wow.
not good in
Wow.
studies. She was saying, "Ki you take them and take their sessions."
Okay. So I would do this as a universal protocol. What I would suggest to you is that first and foremost, put down a list of everything this student likes to do, right? Things engaging with activities, engaging with tangibles, engaging with people. You need to understand the profile. What are their reinforcers? And that's what I mentioned right in the beginning, that you
Mm,
need to be interviewing people that she is contacting with right now. Who are the caregivers? Who are the therapists involved with her? Who are the community people that you can find out? The parents, of course. What are some things that she really, really, really likes? Okay, make it available. You need to become the deliverer of the reinforcer at the get go. When they come to you, it should never be that you have started the session, started the teaching, learning process already, right? You need to
mm,
ensure you have potent reinforcers sufficient available. We call it a buffet of reinforcers. Make the
okay.
buffet available to the child. Everything
Mm,
that they like, make it available, and
mm,
let them engage freely with it.
okay.
Build that rapport. Spend some time in building that rapport with the child, building that trust in the child. That's when slowly you need to increase the heat slowly.
Yeah,
You have to
yeah.
put it in sim or low and loose in the beginning. Slowly increase the heat about the teaching. Do not focus on skill building right away. Focus on building the trust. Focus on building the rapport. Focus on what they like and what they don't like. Be available to them. All the videos that I showed you, and trust me, sorry about the way we look, because we are rolling in the mud with these kids. We are not dressed
Mm,
up when we go to work. We are in casuals. We are available to them to do
mm,
whatever they want us to do, right? That's why we
mm.
look the way we look. But that
Okay.
is the catching point. That is where you're trying to hook them, right? That's
Oh,
a
Yeah,
very good
thank you
question.
so much.
Very good
good
question. Thank
questions,
you.
and we respect the self determination of the student
Ma'am,
always.
one
Yes,
query further
correct.
on this. One
Yeah.
query further on this. If the
Yeah.
child is in grade 7 or grade 8 and she gets scared from the peer group,
Yeah.
because the peers are asking, oh, do you have some problem? Why you are going to the remedial sessions? Or why
Okay.
you are going to those teachers who are actually
Ah,
supported to
yeah.
you? So the
Yeah.
child is escaping the things.
Hmm.
Every time the child comes and she is not able to then pay attention to the things because
Hmm.
everything is roaming in her head. So
Hmm.
how to deal this situation, ma'am?
Yes, very good one. Again, the solution to something huge or bigger, such that you're bringing up, is not going to happen overnight, right? This is a problem with awareness. Okay. See, what I, as a practitioner, I'm seeing is awareness amongst parents itself is so poor. They don't even want to talk about their child with autism or bring them to the forefront, or, expose them to so many scenarios, right? Here we are talking about peers who do not have any context about the child's special need or neurodivergence, or you call it what, right? The difference, right? So I would focus on administrative changes in creating adequate awareness amongst classmates, amongst peers, amongst communities, amongst parents. Awareness is huge. And you are talking about a problem for which I honestly cannot say anything else but talk to those individual peers if you can to begin with, and educate them on the need for this child to be attending a remedial class. That's what I mean. A lot of awareness is in this trip to India. I'm in India right now, and what I'm noticing is that I met with a lot of parents who have the same problems. Some of them are not even forthcoming. They just want to portray their child to be as normal. I mean, again, I don't know what normal means, but to them, the child needs to go to regular school, attending, regular classrooms and with regular peers, doing things that everyone else is doing. Are they capable? Do they have this necessary skill sets? So what you are doing in that remedial classroom is giving them filling those deficits, right? Giving them those skill sets that are such a must. And that needs to be educated. Like, these peers need to be educated, teachers need to be educated. And that's, again, at another level, right? So definitely start with, all you can do at this time is, if she can talk to her peers about how good she is in so many different areas, but in this one area, she needs additional support. And that's why she's going. And self-advocacy, right? She needs to stand up for herself, speak for herself, have confidence in her. You need to build those things in her. She matters. Again, self-determinism that we chatted about, right? So very important.
So
yeah, Doctor.
we definitely will take.
Thank you so much for taking the time. So good to see you always. I
Thank
saw
you.
Shailaja ma'am's name as well.
We definitely
Namaste,
take
all my
everyone's
teachers.
questions. We are a little pause. We have with us Dr. Kiran Bedi ma'am. We welcome you, ma'am. Please.
Thank you.
And yeah, and everyone knows about you, so I don't have this much of anything to say about you. But we can say you are the best guru for me, because मेरी गुरु तो रही नहीं, लेकिन आप गुरु की बहन है, तो मैं always I see Reeta ma'am's all these things with आप में देखता हूँ, तो so we welcome you again. Yeah, ma'am, please. I can't say, मेरे गले भर आते हैं, तो मैं बोल ही नहीं पाता हूँ. Yeah, please, ma'am. So you want to say something, please?
Thank you, Simmi, and thank you, Alok, for what you're
Yeah.
doing in memory of my younger, most loving sister, your teacher, your mentor, and that what you're doing in her memory, and you're perpetuating her memory on a subject which was dearest to her. Autism and all this behavior patterns which you're talking about, she lived it, she breathed it till the last. She worked till her last. Even when she was advised probably to take bed rest, she was still at work because she loved whatever she did. I want to thank you, Alok and Simmi and your team for perpetuating her memory, because in her memory is the cause which you are promoting. All her learnings, all her teachings, all her manuals, all her ideas, and the good news is that you're taking it forward. So I can only say immense love as her sister, who also celebrates her day, both birthday and the day we celebrate her day, because she was a celebration for all of us, a bundle of positive energy. What the theme is, she loved doing whatever she did. She loved her clients, she loved her patients, she loved her students, and gave her every bit. So I want to thank each one of you. I'm so happy that you are together learning from each other, because this is one subject you can learn from each other. You can learn from rules, books, practices, theories, but you can learn so much more and more from each other. So I'm so glad, Simmi, that you're doing this. Thank you so much once again.
Thank you, ma'am. Thank you so much, ma'am. Thank you so much. So yeah, Simmi.
Yes. No. Yeah. I mean, Kiran ma'am knows what she means to me and to the center. Her love for her sister and her love for the cause. Dr. Menon, same thing. Like the way they are unconditionally supporting us. That is the reason each time that energizes me. That is the juice that I take away from India each time I'm here and carry on while I'm there, because your love for your sister, Dr. Menon's love for his wife, all of you siblings, all the family, Ma'am, it just is so, so inspiring that we just can't not do it. We have to do it. So thank you so very much by in touching our lives. Rita ma'am, I always say she touched me like an angel, and she continues to. I feel each time, ma'am. I mean, there are many reasons for us to be disappointed in, not able to achieve the ways we want things to be. But each time I go back with more energy. Where is this coming from? She's watching over every parent that we are meant to reach. We will reach. We will continue to promote her legacy, her works. We will continue to be as empathetic, compassionate, and as ethical as possible. That is a promise that Reeta Peshawaria Center is making to you, ma'am, and the family, and of course Dr. Marine, who is doing a fantastic job carrying forward everything. I'm very, very indebted to all the staff at the center and my family who's supporting me as well. Thank you so very much.
Thank you, ma'am.
Simmi, one thing before I go,
Ji, ma'am.
Anupam Kher has just called me about an hour ago. There's a film, a feature film he's come up on, a feature film, and a girl who was autistic.
Acha. Okay.
At the moment I get the trailer, he's going to send me the trailer. I'll send it, put it in the Reeta Peshawaria group, both for Alok and you and all others to share.
Right.
And as it is, then you can share it amongst all other friends as you wish.
For sure, ma'am.
Similarly, I'm told there's a film by another film, Sitare Zameen Par. So two films I think can do a lot of good by comment sharing.
Okay, ma'am.
Arrange this as soon as I get Sitare Zameen Par to nahi hai mere paas. Anupam Kher ki hai. आएगा ट्रेलर उसने बोला था, and he's doing previewing of it with his friends tomorrow, and then sending me the trailer, and I will then share it with you, and let us look at this film. It's on the subject you are grappling with.
Okay, ma'am. Fantastic. Will do.
Great, ma'am.
And Alok sir ke saath, Alok Indira ji ke saath, pura team ke saath, I'm looking forward to do more of this. I'm more than happy to do pro bono as much as I'm able to.
Definitely.
All the time that I will have, given the time difference. So let's keep this forward. I'm so thankful for their support, continued support to our center. Thank you. Team Manovikas.
Thank you.
Yeah. We have with us Selja Rao, ma'am.
Yes.
Are you there, ma'am? Please, ma'am.
Yes, she's very much there. Ma'am, your face. We want to see you, ma'am. Camera.
Okay. No. Okay, she will join.
Yeah.
So anyone? Yeah, please, ma'am. Okay. So Kiran ma'am has left. So thank you, Kiran ma'am.
That is amazing.
Ma'am. Yeah.
She's coming. She's coming.
Yeah.
Thank you so much for being here, ma'am. Namaste.
Namaste. Unmute yourself, ma'am.
Can't hear you. Can't hear you.
Unmute yourself.
Ma'am, we can't hear you. Unmute, ma'am, please.
Okay.
Yeah,
now can you hear me?
Yes.
Okay. Yes, ma'am.
I didn't realize the button was in my control. Sorry about that. Simmi, congratulations to you and Manovikas team. I'm so glad to see Rita's fundamental, teachings being carried forward. But you have done an amazing job of showing it in action. In those days, we did not have the video support, but fortunately, you have combined it with technology. So we should be thankful to the people who made this possible, that we have the technology. And I think this is a beautiful recording that you have done with the Nadia, right? The child's name is
Nadia's son. Yeah.
Okay. So thanks to the parents for allowing this to be shared with such a large audience. And it is definitely going to help. My only request with you, but of course, I can see the complementary side of the video recording where you have used your own insights as well.
Yes,
you've gone beyond what Rita has taught you. Okay. That's my congratulations to you.
That is not true.
That shows that you're really following the teacher. Okay. So congratulations. My request to you,
Yes.
Can you make a recording available to parents? Because I think many of the parents who are on the platform will agree with me that can you make some recordings where there is a group context related, procedures that we can follow, which are favorable for such children? Because this is one area where when children share their time with siblings and other family members, how these children respond and what is the best way to handle them. Because this is a very complex issue.
Yes.
And people have done storytelling on social relationships, but still it is a very hypothetical situation. But if there could be a real life video recording which can convince parents that this is also possible.
Yes.
This is my major concern, because ultimately these children have to be included in society. So when people see that the child is responding differently, when they handle them differently in a group context, I think it will help them to go a step forward.
Okay.
This is my prayer to you.
No,
And,
please.
it's a wonderful
Just have to
session.
command, ma'am.
And I think we would like to invite you to southern part of the country also.
I will.
I have given your link to many parents.
Okay.
But I myself had a problem getting on, so I don't know if they are facing the same. But I'm glad that I could get through and I could attend this session. It was very useful. Thank you for inviting me. Thank you so much. And thank you, Alok, for arranging this. Thank you so much.
We'll be in
Wonderful
touch,
session.
ma'am. Thanks a lot. Thank you.
Yeah. So
Thanks, Simmi garu.
Thank you, Ramesh Garu.
Yeah.
So good to
Ramesh sir.
have
Yeah,
some
namaskar,
friends and family. Everybody was
Exactly. Very much
very
excited.
kind to join. Yeah.
Thank you.
Even
Thank
for
you.
regular schools, I know you run a school, Ramesh Garu.
Yeah.
So probably, we can chat if there are any behavioral concerns. I'm more than happy to be available to
In fact,
brainstorm.
I invited one of my parents, to go through this session, but he could not able to do it. But definitely.
Okay, awesome. Thanks a lot.
Thank you.
Thanks for being here.
Thank you, ma'am.
Yeah.
So can we take one more question?
Sure. Most certainly. I mean, I'm available if you have the time. I don't mind. Yeah.
We can take one. I have
those who
seen
have
that
to
one
leave
question.
can also leave, Alok. The ones that
definitely.
truly need, some guidance, I'm more than happy to be here.
Karishma ji, can you please? Okay, Rajni ji, you are there. You please ask your question.
Yeah.
Yeah.
Good afternoon, ma'am. Good afternoon, sir. Yeah. My son, he is 18-year-old.
Okay.
And recently, like last 2 months, he has started with spitting, spitting, and sometimes he comes in front of us and spit on our face.
Okay.
Though we don't react to it, but he keeps spitting on face, and after some time he will go. Today morning also I found he went for swimming, and as soon as he came back, I think he was hungry, but though he is verbal, he can tell me. Sometimes he used to tell me also, I'm hungry, but he didn't tell me he's hungry. But after some time, he started spitting everywhere in the hall. Went to bedroom, started spitting. Then I knew because he is hungry. I immediately cut few pieces of cut an apple and gave it to him.
Okay.
Then initially he doesn't want to eat. I don't want to eat apple, he said. Then his dad was going to grocery shop, so he want to go with him. I packed in a tiffin box and sent it with him. So he had it in car, but he didn't have it home. But till he was going out of the door, he was spitting. He was spitting.
Okay.
So, and sometimes what happens, he picks some glass bottle, a small piece of glass or breakable things. He will throw it. We are on the 5th floor. So he threw he goes to the balcony or here from his room, through the window, he threw it down. So these two, though sometimes I could control it. When he was small, I used to do it by putting those things in the dustbin and all. But now he has grown up. I cannot control him, and
Right. Yeah, age is
so
definitely a factor here,
yes.
ma'am. Age
So
definitely is, yeah.
so the those when he was doing those things when he was small,
Mm.
same thing has come up right now. So it was
Okay.
like when he was 5, 6, 7 years, it was there. Then
Right.
it weaned off, and
Yeah.
again it has come. So
Okay.
now I don't know how to control. When he was
Right.
small, we used to spitting only in washroom, wash
Mm.
basin, and all. We used to. Even now, I am using those words and showing this. What I used to write and show also, but
Mm.
now it's not happening somehow. I don't know
Okay.
how
Ma'am,
to.
is he on any medication?
Uh, um, no, ma'am.
No meds.
Uh,
Okay. How
no,
about any
yeah.
form of like we need to, I think again, this is someone I would love to support, like, but we have to do it differently, ma'am. I need a
Yes.
lot of relevant information, right? I need
Okay.
information around many different things because we need to look at a biopsychosocial model of treatment in this case because spitting
Okay.
could mean way more things, right? Something
Okay.
internal, something that is biological in nature, physiological in nature, right? So
Okay.
that is something I would love to be of help to you
Okay.
by, like, you can take my number, I've put it down, that's the same WhatsApp number as well. Just
Okay.
add 001, I think you have to put, and
Okay.
add the number and connect with me.
Okay.
Your name, ma'am, can you say that again?
I am Rajni Satish.
Rajni, right? Rajni.
Yes, ma'am. Yes, ma'am.
Okay, sure, Miss Ma'am. I'll look forward to message from you, and we will chat. Okay, over the
Yes, ma'am. Yes.
yeah, yeah,
Yes.
yeah.
Yes. Thank
Okay,
you so much, ma'am.
you're
Thank
very
you so much.
welcome.
Okay,
You're
thank you,
very
thank
welcome.
you, thank you.
Hmm.
Anyone in the last question? If anyone has any question or any compliment, also we can take. Okay.
Just being here for 2 hours is a big compliment. I don't need it. Thank you so very much. I mean, there are no questions. Then
okay.
yeah.
Okay. Okay. I think done. So Indraji is
मैम
your. Yeah. Please carry on. Yeah. Who is here? Yeah.
मैम मेरा क्वेश्चन है
हाँ जी।
एक स्टूडेंट है
हाँ।
मतलब उसे फूड बहुत पसंद है,
हाँ।
बहुत ज्यादा हेल्दी भी है, बट पेरेंट्स वांट कि आप इसे दूसरे स्टूडेंट्स का फूड मत शेयर किया करें मैम।
एक सेकंड
स्टिल
कौन
अगर
सा फूड?
लंच लंच वो
लंच का कोई भी
सभी स्टूडेंट्स का लंच को टेस्ट करना उसकी हैबिट है,
वो
लेकिन वो
दूसरे
बहुत ज्यादा
स्टूडेंट।
हेल्दी है। तो पेरेंट्स का कंसर्न रहता है कि मैम आप सभी स्टूडेंट का लंच शेयर कराते हो, वैसी हेल्दी है और भी ज्यादा डिफिकल्टीज हो जाएगी। तब उस सिचुएशन पे अगर आप मना करते हो उसे कि दूसरे स्टूडेंट का लंच नहीं खाना है, तो उस समय क्या होता है वो आपको हिट करता है, मतलब इतना हेल्दी है वो देखता है कि सराउंडिंग में कोई नहीं है, तब वो टीचर के ऊपर हाथ उठाना, हिट करना, स्पिट करना, फिर जो उसका बिहेवियर स्टार्ट होता है वो मतलब
राइट
डिफिकल्ट
देखो,
सिचुएशन हो जाती है।
जी। इसको भी कोचिंग टीचिंग की जरूरत है, इसको भी ट्रीटमेंट की जरूरत है कि ना कौन से फूड आपका है, कौन से दूसरों का है, क्या अवेलेबल है, क्या अवेलेबल नहीं है, राइट? एंड ये जो है, दिस इज कमिंग अक्रॉस मोर लाइक समथिंग यू हैव टू सेट लिमिट्स। ओके, लिमिट सेटिंग के लिए हमें काम करना पड़ेगा। तो अगेन गोइंग बैक टू यूनिवर्सल प्रोटोकॉल्स यूज करके जो मैंने आज बताया है, आपको ये बताना पड़ेगा कि हमें इसको रोकना तो पड़ेगा। मे बी इन द बिगिनिंग you may even have to think again. I can't really give you any suggestions clinically like that, but some things that you can try is, I don't know how to say, in school setting it is different. Clinics में हम थोड़े hit भी ले लेते हैं, right? And we are okay with it, ठीक है? And but school में I can't, I'll be very unknown waters है ये ना। तो एक ही है, मैम आपका नाम क्या था?
इकरा।
इकरा, ओ इकरा मैम है क्या अपना? ओके, सो अगेन लाइक मे बी समथिंग, इंदिरा, पूजा, वी कैन ऑल ब्रेनस्टॉर्म, ठीक है, दूसरों का फूड लेने के बारे में। वी रियली नीड, आई थिंक इन योर because it is a special education setting, we can probably work on setting those limits within safe boundaries. समझ रहे हो? इकरा?
यस मैम।
हाँ, हम बात कर चुके हैं ना इकरा?
मैम क्या होता है कि जैसे अभी कुछ टाइम पेरेंट्स का जैसे बहुत ज्यादा कंसर्न आता है कि मैम, क्योंकि वो जब लंच किसी और का लंच खाता है घर जाकर इन्फॉर्म भी करता है कि आज मैं ना आधा पराठा उसका आलू का खा के आया हूँ, तो पेरेंट्स को भी इंफॉर्मेशन मिल जाती, मतलब स्कूल में ये सब हुआ था।
जी
तो
जी जी या
अभी मतलब
थोड़ा
जैसे कि
सा
अभी उसे फूड भी चाहिए होता है, तो कहीं अभी मैंने बीच में ना एक पैटर्न फॉलो किया था कि अच्छा चलो आपको
हाँ,
दूसरों का लंच खाना है, सिर्फ एक बाइट ले लो, उसके बाद हम टच नहीं करेंगे।
जी
तो कभी कभी ये इम्प्लीमेंट करता है, कभी कभी नहीं करता, कभी कभी वो इतना ज्यादा एग्रेशन में आ जाता है कि मतलब आप नहीं हैंडल कर पाओगे उस सिचुएशन में। फिर क्या होता है,
राइट,
अदर स्टूडेंट भी देखते हैं
ये
बिहेवियर
थोड़ा
को,
ट्रिकी
कहीं
है।
ना कहीं वो, हाँ।
या या
मैं
आई एम मोर देन हैप्पी टू डिस्कस। इंदिरा, ये आपके स्कूल का है ना? इज देयर ना? इसको हम डिस्कस कर लेते हैं, ठीक है?
but I want to say you have to see in the two perspectives.
हाँ जी
एक तो उस बच्चे का प्रॉब्लम बिहेवियर,
जी,
और वो जब घर जाता है तो पेरेंट्स को बोलता है कि मैं आज उसका खा के आया हूँ, so he was
ओके,
getting the attention also.
ओके ओके,
Okay.
मेक सेंस। हाँ,
हाँ, तो वो दोनों पर्सपेक्टिव को देखो।
देख के
पेरेंट्स को
हाँ,
बोलो कि अटेंशन कम दे, कि भाई वो क्या खा के आया क्या खा कर नहीं आया, क्योंकि पेरेंट्स उसके बाद क्या करता है, वो ब्रस्ट होता है, तुम पे चिल्लाते हैं, उस बच्चे पे चिल्लाते हैं, तो उसको अच्छा लगता होगा, ही वाज एंजॉयिंग दैट पार्ट आल्सो।
राइट। सो
ओके।
हमें नहीं, एक तो पूरा प्रोफाइल देख के वेरी स्लो स्टेप्स हमें स्टार्ट करना पड़ेगा। वी हैव टू कीप, दूसरे बच्चे लाते क्या है जो ये नहीं लाता है, वो चीज इसको अवेलेबल करना भी पड़ेगा, बिकॉज ही रियली वांट्स टू ईट आल्सो probably as much as you have a point, Alok, that he may be getting the attention from the parents and all that, but he may also like those things that others
That
are
things,
getting.
yeah.
ठीक है? तो सारे एंगल से इसे जरा ना प्रॉपर असेसमेंट करके देन इज व्हेन वी विल कम अप विद अ प्रॉपर प्लान। ठीक है? एक बार पहुंच जाने तो मुझे, फिर हम रेगुलर मीटिंग्स का रखते हैं ताकि वी कैन वर्क ऑन दिस। ऑलराइट?
So
हाँ
yes,
हाँ
सर,
जी,
एक क्वेश्चन और है।
हाँ जी।
बाद में ऑफलाइन नहीं कर लेंगे? ओके
नहीं
ओके,
क्वेश्चन प्लीज।
हाँ प्लीज प्लीज प्लीज, अच्छा कोई नहीं, लेट आस्क योर
हाँ,
क्वेश्चन।
जैसे लास्ट सेशन में ना मैम ने एक टेक्निक बताई थी हमें, रेड कार्ड और ग्रीन कार्ड, मतलब
कौन सा कार्ड था?
इम्प्लीमेंट रेड
रिमाइंड।
कार्ड और
रेड,
ग्रीन कार्ड, मतलब
अच्छा अच्छा,
जैसे
रेड एंड ग्रीन कार्ड,
कर रहे हैं।
अवेलेबल नॉट
Right.
अवेलेबल वाली। अच्छा,
हाँ हाँ,
हाँ जी।
ये मैंने क्लास में इम्प्लीमेंट की, कई कुछ समय बहुत ज्यादा मतलब इम्प्लीमेंट करने के बाद रिजल्ट आया। आई फील ऑल्सो गुड कि हाँ, जो मैं टेक्निक इम्प्लीमेंट कर रही हूँ रिजल्ट आ रहा है, और स्टूडेंट भी कहीं ना कहीं सेटल डाउन हो रहे हैं।
ओके,
लेकिन कल जब, क्योंकि वो दूसरी क्लास में गए थे, मैं वहां बोल कर आई है कि अभी रेड कार्ड ऑन है, आप सर की बात सुनोगे, जो भी सर बोलेंगे आप डिस्ट्रैक्ट नहीं करोगे। उस टाइम मैं क्लास में नहीं थी, तो वो जो रेड कार्ड वाला टैग था वो वहाँ वर्क ही नहीं किया। सारे स्टूडेंट्स मतलब सर की बात को फॉलो नहीं किया, और मतलब क्योंकि अभी 1 वीक से मैं ये इम्प्लीमेंट कर रही हूँ, रिजल्ट आ रहा था, मुझे लगा कि अब मैं हूँ नहीं हूँ, लेकिन रेड कार्ड ऑन है तो सभी स्टूडेंट क्या करेंगे, सर की बात को इम्प्लीमेंट करेंगे और बोलेंगे नहीं, फोकस रहेगा टास्क पर, लेकिन वो इम्प्लीमेंट नहीं हुआ कर।
ठीक है।
तो कई बार कभी कभी नहीं इम्प्लीमेंट हो रहा, तो उसके लिए क्या करें?
क्या करना चाहिए? यहीं पर फ्लेक्सिबिलिटी है हमारे प्रोग्राम में। ठीक है? हमारा प्रोग्राम रिटन इन स्टोन नहीं है। दिस इज अ वेरी फ्लेक्सिबल प्रोग्राम। अगर कुछ चीज काम नहीं कर रहा है तो फॉलो द लीड ऑफ द स्टूडेंट्स। अगर पूरा क्लास में आप कोशिश कर रहे हो तो व्हाट इज इट दैट दे आर टेलिंग यू? आई वुड डू मोर ऑब्जर्वेशंस। आई वुड कम अप विथ समथिंग दैट ट्रूली जेन्युइनली वर्क्स फॉर देम, बिकॉज आई एम नॉट देयर। आई डोंट नो एग्जैक्टली आपका प्रोफाइल पूरे स्टूडेंट्स का क्या है। आई डोंट नो द इम्प्लीमेंटेशन फिडिलिटी कैसा है। हाउ आर यू इम्प्लीमेंटिंग? इज देयर इंटेग्रिटी इन द वे आप लोग जो प्रोग्राम इम्प्लीमेंट कर रहे हो? ये भी देखना जरूरी है। कंसिस्टेंसी है कि नहीं, ये देखना जरूरी है। सभी एक जैसे कर रहे हैं, कुछ लोग अलग कर रहे हैं, ये देखना जरूरी है। बट एट द एंड ऑफ द डे, follow the child's lead. That is most important. Follow. If something is not working, clearly it is not working. Okay? We need to make modifications. So that is where you need to make a judgment call on what kind of modification is required and how do we go about it.
Yeah.
Again, this is, we'll brainstorm, no issues.
Definitely.
बहुत होता है इसमें.
Yes, great.
Okay.
So we have the some request for the PowerPoint sharing, PowerPoint presentation sharing. Okay, we will share. Can we share the PPT?
I would be a little bit cautious about the videos. As much as mom gave me the permission to share it for the presentation.
Can you take out the videos, then we can share that.
Take out the videos and share, no issues.
Yeah, that will be better.
That should be fine. Yeah. But I also want to caution everyone that you're sharing with. This is just an introduction to the technique. ठीक है? अगर जानना हो ज़्यादा, I'm more than happy to be supportive in helping you with this. But don't, because there is also a risk involved when people are implementing strategies that are not necessarily something they know really well. हम भी अभी सीख ही रहे हैं. Every single day नई चीजें सीख रहे हैं. But मैं जो present करने का state में आई हूँ ना, it is because ये proven है with my own experience, right? That's why the videos that I showed you, right? So yes, definitely universal है बहुत सारी चीजें, लेकिन कोई particular case, especially severe behaviors में आप अगर implement कर रहे हो तो एक बार मुझे बता के पूछ के फिर कर सकते हैं, ठीक है? But most of the 7 protocols जो है वो बहुत ही user friendly है, parents, teachers, everyone can use it, right? And I'm open to any clarifications later, ठीक है? So definitely
I think
go ahead.
It was a great, wonderful session.
Thank you.
Enlightening session.
Thank you so much.
Lamba session.
Being present and all my friends from all over being present, everyone. Kiran ma'am ka aana. Yes, ma'am. PPT only. Thank you for saying that. See, ma'am.
Yes. Indra ma'am, please.
Yeah. Thank you, ma'am.
So thank you, ma'am. Thank you. It's a very wonderful session.
Thank you, everyone. Thank you.
Thank you, everyone. Thank you, Dr. Kiran ma'am. Thank you, Dr. Nimish Desai sir. Thank you, Sanjay Rao ma'am. And thank you, everyone, each and everyone. मैं बहुतों को नहीं जानती हूँ, पर आप सभी को बहुत धन्यवाद आज के इस सेशन के लिए और धन्यवाद करना चाहूँगी.
Dasrath is here. Yeah.
Thank you, Alok bhaiya. Thank you, Simmi ma'am. We are very lovely to. I am your you can say I am a junior. Sorry, I'm driving, so I cannot interact you all. But मैं अपने आप को रोक नहीं पाया आप लोगों से interact करने के लिए, क्योंकि it was a very wonderful session.
Thanks, my dear.
And thank you, Alok bhaiya.
Thank you. Yes, carry on.
मेरे कुछ बोकारो के friends भी मतलब there's a group there, and I really thank Bikram who has spent time to be here. I really can't see everyone, but जितने लोग भी time और efforts निकाल के यहाँ सुनने को आए, मैं बहुत ज़्यादा तहे दिल से शुक्रिया to everyone. And you guys, Manovikas family, Pooja and Alok and Indira ma'am, everyone, okay? We'll continue this. I'm passionate about this. I'm more than happy to do it if time permits and time zone.
We will in touch.
Thank you, Pooja, कि आपके इस प्रयास से इतने सारे पार्टिसिपेंट हमारे पास आए थे और एक नई पहल थी, एक नया टेक्निक था जो आज सिमी मैम ने बताया और आपके इस प्रयास के लिए बहुत धन्यवाद. यस, हम लोग आगे भी बहुत सारे सेशंस करते रहेंगे. जैसे भी हमारे व्यूअर्स के, हमारे पार्टिसिपेंट्स के क्वारीज आएंगे उसके ऊपर भी हम डिस्कस करके आगे भी मौका ऐसा हमें मिलता रहेगा. सो थैंक यू एवरीवन, आप सबका यहाँ पे रहने के लिए, पूरे 2.5 घंटे रहने के लिए.
इंदिरा, मधुमिता क्या कह रही है?
Thank you so much. Thank you so much. You lovely say and like it so much. Presentation. Thank you for the
You're very welcome.
So much listening of speaking very well and then well done.
Okay, my dear.
And the movie also Tare Time पर talk lovely. You are a lovely person.
Madhumita is our regular viewer. So thank you, Madhumita.
Really?
Yeah.
Thank you. So sweet of her. So sweet.
Thank you, Simmi
बहुत
ma'am. Once
encouraging
again.
होता है ऐसे बात.
Yes.
Yes.
Okay,
And
my
we will
dear.
share
Bye,
we
bye,
will
bye.
share all the presentations and whatever it is through your email. We have already the email. So thank you all for joining us. Thank you, everyone. Thank you.
All right. Have a good one. Rest of the day.
Okay. Bye.
Bye.
Thank you, ma'am. Thank you.
Including regarding of this session, right, sir?
Yeah.
Yeah.
Regarding
Regarding this session.
we will share you the link. We will share you the link because the sessions are already on the social media. So we will share you.
Okay.
मुझे भी भेज देना.
Definitely.
Hello.
Definitely. It is there. It is there on the Facebook. You were live on the Facebook and YouTube.
Oh wow.
Great.
So we had a lot of viewers there.
Thanks.
Thank you. Thanks a lot.
Take care, everyone. Bye, Ramesh.
Bye.